The topic of this screencast is lung volumes and capacities. You may find this topic in Chapter 13 of your textbook.
This screencast was designed to help you achieve the following objectives. Describe a spirometer and how it is used to determine lung volumes and capacities. Define the following and identify each on a spirogram. Tidal volume, residual volume, expiratory reserve volume, inspiratory reserve volume, vital capacity, total lung capacity, dead space volume, and functional volume.
In order to correctly diagnose a disease that is affecting ventilation, it is necessary to have the ability to measure various capacities and volumes of the lung. What are capacities and volumes, you may ask? Well, a volume is a specific amount of air entering or exiting the lungs, and capacities are combinations of these volumes. An instrument used to measure volumes as well as the movement of air into or out of the lungs is called a spirometer. A spirometer consists of a mouthpiece and a tube connected to a measuring device. The patient is asked to perform different breathing actions, and the recording is made called a spirogram. By analyzing a spirogram, the various lung volumes and capacities can be determined.
We will use this spirogram from your book to identify various lung volumes and capacities. Time is plotted on the x-axis in milliseconds and lung volume on the y-axis in milliliters. We will begin our spirometry tracing at the transition point. And if you recall, the transition point is the point after exhalation and just prior to inhalation. So after you breathe out, right before you start breathing in again, that is where we're starting as designated by the red arrow. So if you take a quiet, normal breath, you breathe in, you breathe out. The amount of air that enters and exits the respiratory tract is called the tidal volume. So that's just the normal amount of volume that enters and exits your body, your respiratory system during normal, quiet breathing. And that's roughly 500 milliliters. Now let's say you do a maximum inhalation. You breathe in as much air as possible. So there you go, you breathe in maximally. The amount of air that enters the respiratory system during a maximum inhalation above that of tidal volume is called the inspiratory reserve volume. So that's the amount of air that enters a respiratory tract above tidal volume when you inspire maximally. Now let's say you then turn around and you do a maximum exhalation. You expire maximally. You empty your lungs and your respiratory tract of as much air as possible. The amount that exits your respiratory tract in excess of tidal volume is the expiratory reserve volume. Now, if we add the inspiratory reserve volume and the tidal volume and the expiratory reserve volume, we get the maximum amount of air that you can bring into and out of your lungs. And that is called the vital capacity. That's the maximum amount of air that can enter and exit your respiratory tract. Again, if you breathe in as much as possible and then exhale as much as possible, that's the total amount of air that can enter and exit your respiratory tract. Now notice that there is always some air in the lungs, even when you exhale as much as possible. And that volume is called the residual volume. So even if you exhale maximally, empty your lungs of as much air as possible, there's still a residual volume of air in your lungs. So your lungs always have air in them, even when you exhale. Why might you want to always have air in your lungs? Think about this for a second. Perhaps pause the video and then we'll restart. Okay, so have you come up with anything? Any idea of why you never want to empty your lungs completely of air? Well, there are two reasons. One, even when you exhale, there's blood moving through the lungs. So you always want to have air in the lungs to participate in gas exchange. It's not as though blood stops moving through the lungs just because you're exhaling. It's always moving through, and you always want to have some air in the lungs for that reason. Another reason why you want to always have air in the lungs is because you never want your lungs, your alveoli, to collapse. Think about when you go to blow up a balloon. When do you have to use the most effort, the most energy in blowing up a balloon? It's always at the very beginning. Once you get the balloon going, it's all downhill from there in terms of how much effort and energy you have to expend. But really, that initial expansion of the wall of the balloon takes a lot of energy. Well, the same is true of the alveoli. If your lungs collapsed every time you exhaled, it would take a great deal of energy for that initial reinflation of your alveoli. So you never want your lungs to collapse when you're exhaling because it takes a lot of energy to reinflate those alveoli. If we take the vital capacity and we add to it the residual volume, then we have your total lung capacity. So that's the total amount of air that your lungs can hold. So in other words, if you took a maximum inhalation, the total amount of air in your lungs would be the total lung capacity. That would include the inspiratory reserve volume, the tidal volume, the respiratory reserve volume, as well as the residual volume. There are two additional volumes that I want you to be familiar with, and they relate to tidal volume. So let's again restate what tidal volume is. So tidal volume is the amount of air that enters and exits the respiratory system every time you inhale and then exhale during normal, quiet breathing. And it's about 500 milliliters. When you inhale, not all of the air that enters your respiratory system actually reaches the alveoli of the lungs. Some of that air remains in the conducting zone. It remains in your nasal cavity, your pharynx or throat, your larynx, your trachea, the bronchi, and the terminal bronchioles, none of which have alveoli and participate in gas exchange. The air that remains in the conducting zone is referred to as the dead space volume, and typically it's around 150 milliliters. The air that actually gets to the alveoli of the lungs and therefore participates in external respiration is called the functional volume. So again, this is the air that you inhale that actually participates in gas exchange. So we can calculate the functional volume by taking the tidal volume, the amount of air that enters and exits the respiratory tract, usually it's around 500 milliliters, and subtract the dead space volume, which is typically around 150 milliliters, to get the functional volume, which is 350 milliliters in this example. Now, I do want you to understand that you are not responsible for memorizing the typical values for these various volumes and capacities. We include these numbers so you can get a sense of the magnitude of these different volumes and capacities. However, in no way are you responsible for memorizing tidal volume or inspiratory or expiratory reserve volume. I want you to know what they are. I want you to know how they relate to one another. If I were to give you the dead space volume and the tidal volume, you should be able to calculate functional volume if you understand these concepts. However, I want to be clear that you are not responsible for learning the values for any of these volumes or capacities. Now let's review the objectives of the screencast. Describe a spirometer and how it is used to determine lung volumes and capacities. Define the following and identify each on a spirogram. Tidal volume, residual volume, expiratory reserve volume, inspiratory reserve volume, vital capacity, total lung capacity, dead space volume, and finally functional volume.
The topic of the next screencast is gas exchange and transport.